I see kids that have been, having ear infections from swimming in the water, swimmer's ear. I see adults that have been shooting, and I see older people who are like, look, I've got ringing in my ears and I don't hear as well as I used to. So having a hearing problem is just part of being a human being, whether it's from a viral process or whether it's a genetic problem or whether it's from having an ear infection or whether it's from trauma or even if it's involved with, possibly an inner ear mass or tumor. Hearing loss, it is treated by an ENT doctor, and it's something that we have good treatment options for, and I'd love to be able to see and help people who have problems.
Welcome to the Swain Sinus Show, a physician and patient discussion on how to better manage and treat mild to serious sinus issues and conditions. From diagnosis, treatment, home remedies, and surgery, Stacy and Dr. Swain will talk about improving your quality of life, breathing easier, and feeling better. Let's take control over our sinuses and allergies so they don't control us.
Hello again, podcast listeners. This is your host, Stacy Wellborn, sitting here with Dr. Ron Swain. Today, we're going to talk about hearing loss. Dr. Swain, are you excited to talk about hearing loss today?
I'm sorry, Stacy, what? I couldn't hear you?
Ha, funny guy. No, seriously.
That's an ENT doctor joke, actually. Sometimes when I'm coming in to talk to my patients and I'm asking them, well, why are you here? Are you having trouble with your hearing? And they're like, huh? What? The first time it happened, Stacy, it took me a couple of times. I asked the question again, why are you here? And they're smiling at me the whole time going, what? I can't hear you. And so it took me a while to kind of catch on. So that's an ENT doctor joke, I guess.
So I thought you only did noses and sinus stuff.
Well, I do a lot of noses, but as an ENT doctor, we're all trained to do all parts of ear, nose, and throat of otolaryngology. And certainly a big part of any ENT practice is dealing with the ears. Your sense of hearing is so important, and it affects people from all ages. I see kids whose mothers are bringing them in because they're having ear infections. I see kids that have been, having ear infections from swimming in the water, swimmer's ear. I see adults that have been shooting, and I see older people who are like, look, I've got ringing in my ears and I don't hear as well as I used to. So having a hearing problem is just part of being a human being. It's a big part of what we do. One other thing I wanted to bring up, which I get asked about all the time, you're a sinus doctor and people come in and have sinus problems, but they also look at me and say, I can't hear. Or my ears are all congested. And how are those two related? Which is a great point, really, because when I'm walking in the room and I look at why somebody's there, it'll say all the time sinus/ear.
It's pretty general.
It's pretty general, but, I see it so often. And so, when somebody comes in and they have a bad sinus infection and their nose is congested, a lot of times their ear feels congested. And if you're really sick, sometimes you do have an ear infection. And the question is why? Well, obviously, besides the fact that you're sick and you can get both, everything in that area is connected. In the back of the nose, right where the nasal cavity kind of ends, your eustachian tube opens. And so your eustachian tube is the tube that goes from the ear to the back of your nose. And so, like when you go up on an airplane, which we're going to talk about, I guess, in the next show, when your ear pop, that's because your eustachian tube is opening, allowing the air pressure to equilibrate. Or for all the scuba divers out there, if you're going underwater and you go into depth and all of a sudden you feel that pressure in your ear, you're taught to Valsalva. When you kind of pinch your nose and blow and your ears pop, you're equalizing the pressure. And so when your nose gets super congested like that, a lot of times the first thing you feel like is my ear stops up because the eustachian tube quits working normally. You can get some swelling around it due to a viral illness. And if the eustachian tube stays swollen long enough, you can actually get some fluid behind the eardrum. And little kids, I put all these tubes in kids' ears. And little kids, when they're in daycare and they're constantly inundated with viral illness, their eustachian tube is little and it doesn't function that well. So that's why these kids get all the ear infections. And a tube, it just bypasses the eustachian tube. Oh. And so the same thing when you're an adult, except for the fact that if we put you on really good medications, a lot of times we can get that eustachian tube to open back up without having to...
Because you're cleaning out the sinuses, essentially, to give the eustachian tube...
Well, we're allowing the inflammation to decrease, but you're correct. And there are actually some sinus conditions that when the sinuses get real bad, the ear gets real bad. And some of the things we used for the sinuses, sometimes we'll use in the ear. Now, that's rare, but that does happen. So not an uncommon problem. The other thing is sometimes, we tell people all the time, rinse. We talked about all these nasal rinses
Right.
we do.
Yeah, that I don't do.
Right. Right.
They kind of freak me out.
Right. Well, a lot of times people don't like to do it because when you talk to them and they start rinsing, they feel like my ear stops up. And that's because of the eustachian tube. So they're connected. Your ears and your nose and your throat are all connected. And so that's one reason why people will complain of, when they have a bad sinus problem, they have ear problems.
How do you diagnose hearing issues?
That is a really good question. So first thing, you take a history, obviously, and there's some things that are more obvious than others. For example, if somebody comes in and says, look, I was water skiing and I fell and I hit the water and my ear hurts and I can't hear out of my ear. You really suspect that person's got a hole in their eardrum or traumatized their eardrum. There are other people that come in and say, look, I can't hear and you need to get a hearing test. So an audiogram is what it's called. You sit people in a booth similar to this that's soundproof, and the audiologist is there and they test them. And they test how they hear with different sounds. They also test the pressure behind the eardrum as well. It doesn't take long. Pretty much all of it is covered by your insurance company for the most part, although I have seen a few Medicare plans that don't cover audiograms, which is very rare because when somebody comes in with a hearing complaint, the only way you can tell is, you can snap your fingers on each side of the ear, but you need something more scientific than that. The only way to tell is really to get a hearing test.
Right, because there's some precision in that. Or there was my husband, Johnny often says he has 30% hearing loss in his right ear.
Yeah.
So he's obviously been tested, and that's the type of result or feedback you would receive.
Correct. There's actually a formula because everybody wants, when they come in and they have hearing loss, the first thing people ask is, well, what's my percentage of loss? And there's actually a formula for that, for figuring out what percentage it is. It's really not, that's not as useful an information to the physician or for a patient as in terms of where is the hearing loss? Is it high frequencies?
Right.
Are you having trouble hearing alarms, doorbells, that kind of stuff? Is it low frequency, which is a lot less common, but still present? Is it your discrimination?
What does that mean?
Well, that's your ability to distinguish between different words, boy, toy, joy.
Okay.
So let's say you had hearing loss and we're sitting here and we're in a quiet room. You and I are facing each other. You could probably get every word that I said over the course of the entire afternoon. But if we all of a sudden went out to a restaurant and there are 100 people around us and there's background music, and there's a lot of ambient background noise, then all of a sudden it gets tougher.
Right.
Because you can't hear as well. There's a lot of background noise. And so people miss words. And so to distinguish how people are hearing or what kind of hearing loss they have, it requires a good audiogram. Let's just talk about for a second, when you get a hearing test and you have a hearing problem, you're kind of classified into 3 types of hearing loss. One is a conductive hearing loss. And that means the little bones in your ear, the malleus, the incus, and the stapes and the eardrum, there's some kind of problem with how the sound wave hits the eardrum and is transmitted from mechanical injury or sound energy into a neural process into the inner ear. And then there's neural hearing loss, which is the little bones in your middle ear are fine, but you have a problem with the nerve, with the end organ, with the cochlea. So the cochlea and the cochlear nerve somehow are impaired.
Okay.
And that can be from age, it can be from viral illnesses or other diseases, it can be from tumors. And a conductive hearing loss can be from trauma, it can be from infection. And so it gets kind of complicated when you're trying to sort out, why does someone have hearing loss? If you know you have a neural problem, that's great. You've got a neural problem, but what's the cause of it? And so then it gets to be a little more scientific in trying to figure out, how do you help somebody?
You mentioned there was a third type.
A mixed pattern.
Okay.
So there's some people that have a little bit of conductive hearing loss and a little bit of neural hearing loss. And the question is okay, what do you do for those people? And a lot of it depends on their circumstances. If they have a little bit of fluid behind the eardrum, but they're older and they really don't want you to do something aggressive to try to help with like a surgical procedure, sometimes with a hearing aid, you can overcome a little bit of the conductive hearing loss as well. It gets to be more of the art of medicine, trying to figure out how to help somebody hear better.
So we've talked a little bit about hearing aids. What are some other treatments that you use for hearing loss?
Well, it depends on what the cause of it is. A lot of times, we'll just talk about kids for a second. If they have a bad ear infection, if you can get rid of the ear infection itself, the hearing improves. And if they're getting repetitive ear infections over and over and over again, then we'll talk about putting tubes in the ears. We've talked about that on other shows, but the idea behind that is if you can clear up the middle ear, if you can get the ear from being so infected, hearing will improve. We know that kids that have chronic hearing issues and speech delay, a lot of it's because they're having repetitive ear infections. So that's something we see commonly. The other thing is noise trauma.
Right.
Certainly in Alabama, a lot of people hunt, and not a lot of people wear ear protection when they hunt. And so The blast from a muzzle of a shotgun or a high-powered rifle certainly can damage hearing. We also see people that develop viral illnesses like sudden hearing loss. And so people come in and they're saying, hey, I've had hearing loss for months. You treat that person differently than someone that comes in and says, hey, I was fine last night and I woke up and I can't hear out of my ear. So sudden hearing loss is one of the ENT emergencies.
Right.
And there are lots of different ways we go about treating that. Sometimes we put medicines in the ear. Sometimes we give people oral medications.
Okay. So if I'm a listener to our podcast and I think I may have some hearing loss, at what point do you recommend I come in to see a doctor?
I think if you're having questions about hearing loss, you need to get a hearing test. It's kind of like a vision test. If you think your vision's going wrong, why wouldn't you get a test for your vision? It's the same thing. There are lots of places that offer hearing screening tests. Sometimes those screening tests may not be as accurate as sitting someone in an audiological booth with an audiologist and to get a real honest-to-goodness hearing test. That's kind of the gold standard for if you really suspect that someone's got hearing loss.
So at Premier Medical, you have audiologists on site, on staff?
Yes.
Okay.
5 days a week.
Okay. So do I need to see an ENT doctor before I can have an audiology test?
There are some places that offer free screening, but in terms of an audiometric booth with an audiologist, usually you're going to end up seeing the ENT doctor first. They have to screen your ear, look in your ear. I mean, you don't want to get a hearing test if you had an ear full of wax.
Right.
Because then you get a hearing test that's not accurate. So when we see someone with that suspected hearing, the first thing we do is we look in the ear and make sure there's not draining, there's not a foreign body in the ear. It happened yesterday. I had a family came in, thought the child wasn't hearing that well, get the child to lay still, look in the ear, and I pulled an eraser out of the ear.
Oh my gosh.
And the dad was like, I don't know how that got in there. And the child was like, I don't know how that got in there. Well, sometimes things just get in there. It just happens. And so once you make sure the ear is clean and it's in good condition to be tested, you can get a quick test. They actually don't take that long.
So I'm on a college campus often, and almost every student walking around has earbuds in their ears. That just seems like a walking problem. Is it?
It can be. I've got teenagers too. And so I'm constantly trying to yell and scream and holler and saying, hey, come to dinner or whatever.
Right.
And they've got an earbud in their ear and they can't hear. And so as a parent, as an ENT doctor, I'm always concerned about the volume of the earbud. There are certainly a lot of articles and a lot of talk right now on the internet about the noise level and the possibility of hearing loss. Mm-hmm. It doesn't matter whether it's an earbud, a speaker at a concert, or a rifle that's being shot. If you are exposed to loud noise chronically long enough, it can damage your hearing. I guess this generation is not having to crank up the music so loud throughout the house. In the old days, your parents would knock on the wall and say, hey, the music is too loud. Now you don't hear anything and you don't know how loud. You have
no idea what they're listening to.
Right, you have no idea what they're listening to and how loud it is. So I think it's a big deal. And I think more kids need to be aware of, or certainly parents need to be aware of, the possibility of your kid listening to music that's too loud. It's not one of those things that gets you when you're young, but if you've been listening to loud music for a long time, as you go through life, it does catch up with you.
So it doesn't really matter if it's earbuds or over-the-ear earphones. It's the volume.
It's the volume.
Regardless.
Yeah. An earbud at a low level is not going to cause you any trouble. It's just like, us talking. It's the volume of it. And I think a lot of times kids don't realize how loud it is.
Right.
If you're driving in the car and your kid's listening to the earbud in the back and you can hear the music, that's too loud.
Right.
The other thing that I do sometimes is I'll make my kids give me their earbud to listen to see what how loud it is. So those are some different strategies. But from a practical standpoint too, if you're walking around, you got earbuds in your ears, from a safety standpoint, you don't know who's behind you,
right,
what's going on around you. So, because those things are good. I mean, they really work well, but it blocks a lot of stuff out.
Well, I have a constant battle in my house because my husband, Johnny, constantly wears his earbuds, and I go to say something and he doesn't hear me. And it's not because of the hearing loss. It's because of those dang earbuds constantly in his ears. So I'm going to give him some of these tips and encourage him to maybe take them out every now and then.
I agree. That's probably a good idea.
Well, Dr. Swain, this is the Swain Sinus Show, and we've talked a lot about sinuses. We've talked about earaches, and we have talked about ears related to sinus, but this is really the first time we've talked about that you work with hearing loss related to injury or music or shotguns. So do you see a lot of people related to hearing loss not related to sinus issues?
Yes, Stacy, we provide care and evaluation for people with hearing loss, whether it's from a viral process, or whether it's a genetic problem, or whether it's from having an ear infection, or whether it's from trauma, or even if it's involved with possibly an inner ear mass or tumor. I think that's the biggest thing people can take away from the show, is that hearing loss is common. It is treated by an ENT doctor, and it's something that we have good treatment options for. And I'd love to be able to see and help people who have problems.
Well, all of you guys listening to this podcast on your earbuds, hopefully it's at an appropriate level. And should you need help with your hearing, where do they go?
The easiest way is to call the office at 251-473-1900 or 251-633-2667. The other ways are through the web. We've got multiple options there. We're not hard to find. So the first one is mobileentdoctordr.com. That's mobileentdr.com. The second one is premiermedicalgrp.com. That's the main site for the office. And then obviously there are links in the Swain Sinus Show that will direct you to the appropriate place. And finally there's ronswainjr.com, ronswainjr.com.
Wow, you're everywhere.
I'm trying to be.
Well, you are the sinus doctor for our area, so.
Well, thank you. Enjoyed being here today.
It's been great.
Thank you.
Thanks for listening to the Swain Sinus Show. Please subscribe to our show on iTunes, Overcast, and anywhere you download your favorite podcasts. Want to know more about Dr. Swain or to schedule a consultation or appointment? Visit SwainSinusShow.com or call his amazing nursing staff at 251-470-8823. We would love to hear what you think about the show. Email us at drswain@drronswain.com. Again, thanks for listening. Breathe easy and have a great day. This show is brought to you in part by the fine physicians and friendly staff at Premier Medical Group in Mobile, Alabama.